Welcome to Nursing Success TV, where we share stories and ideas to help you chart your future. Coming up this month, Dr. Phyllis answers a question from a nurse feeling excluded by her coworkers. And Terry Gaffney from the American Nurses Association discusses the value of nursing association memberships. And we bring you a very personal story of one nurse's success.
Ask Dr. Phyllis is brought to you by New York Presbyterian Hospital. Amazing things are happening here.
Today's question for Dr. Phyllis comes from Natalie, an RN in Texas, who writes, I just started working in a busy ambulatory clinic in a predominantly Hispanic area, and I do not speak Spanish. Most of the patients are fluent in English and Spanish, and I've had no problems interacting with them. But despite being bilingual, most of my nursing coworkers will only speak Spanish around me. The longer this goes on, the more I feel like an outcast. What should I do?
Natalie, I'm unclear. Have you shared your feelings with your colleagues or not? And if you haven't, why don't you take a few minutes, invite them into a private area, and just be honest. Say to them that you need for them to speak English when you're in the group. However, your situation is a bit unusual in that you're telling me this is not interfering with your ability to do your job, given the population that you're working with and the area that you're working with. Have you considered the possibility that you've inadvertently offended your patients and perhaps your colleagues by expecting them to meet your needs? So my question to you, Natalie, is simple. What would it take for you to learn how to speak Spanish? You want to be a part of the group? I think you might need to make an effort. At the very least, you'd be signaling to the group that you're willing. And, of course, you would be gaining a valuable skill.
Email your questions to askdrphyllis@nursingsuccess.tv. Terry Gaffney is the Senior Director of Product Development with the American Nurses Association. Terry holds a Bachelor of Science in Nursing, a Master's in Public Administration, and is currently a nursing PhD candidate. Today, she shares the value of membership in nursing associations.
In my career, my affiliation with professional nursing associations helped me a great deal, and there are three specific ways that come to mind. First is leadership development, the second is building my network, and the third is expanding my skill set. So for example, when I got involved in nursing associations, it helped me build my community of nurses across not only my community, but even outside into national areas. So it helped me become a well-rounded nurse, able to affect very different areas. Because after all, our goal is to advocate. And as a nurse, I could advocate in the clinical environment for my patient, but being in a nursing association, it gave me a broader base to advocate for the public as a whole. My job specifically at the American Nurses Association is to translate a lot of the work the organization is doing into products that nurses can use, whether they're practicing at the clinical bedside or in other nursing environments. For example, staffing is an issue that concerns nurses across the country. So we looked at optimal nurse staffing. Many nurses don't understand how staffing is configured or the finances behind the staffing decisions that are made. So we developed an easy-to-read, short booklet, Staffing 101, to help nurses understand why decisions are made the way they are in regard to staffing. Membership in the nursing associations offer a wealth of opportunities, and you can choose to be as involved as your time permits. Nurses are busy, going back to school and raising families and trying to work. So these associations offer an opportunity to do as much or as little as you want. You can attend conferences. There are lots of face-to-face meetings where you can gain knowledge and expand your contact list. But there are also lots of virtual opportunities, ways to undergo opportunities for professional development, ways to connect with people. Every state nurses association basically has a legislative day where you can get to know the members of your state legislature, as well as your nursing community, and advance health policy. So there's so many different opportunities to get involved in these professional nursing associations, and you can serve on a committee, run for an office, be a delegate to the national organization, So there's lots of opportunities and choices.
One Nurse's Success is brought to you by Kaiser Permanente.
My mother was a surgeon, so I grew up in hospitals. And yet, when it came time to go to college, I started in pre-med. I decided somehow along the line that I would rather spend more time with my children. And so I ended up going into journalism. About the time of 9/11, as I was sitting on the edge of the bed with one son under this arm and one son under this arm, I watched all of this unfold. I think any American would lie if they said that moment didn't change them. And that's why my focus has always been on critical care, trauma, emergency medicine, the things that I focused on, because if something happens, I want to be equipped to be of assistance. I went overseas. I was in the ICU in Landstuhl, Germany, taking care of these soldiers that were flying in from Afghanistan, and the Marines are a special breed of individuals. This one patient that I had, he was my first patient to have 3 limbs amputated. I was blessed enough to be able to pull the breathing tube out of him so that he could talk. When I pulled the breathing tube, he looked me square in the eye and said, "Why so sad, ma'am? I would do it all over again for my country." I was blown away, thinking, here's a man who's lost 2 legs and an arm, and he's more worried about my sadness. How crazy is that? And it really changed the way that I approached my patients from then on. That individual, I wrote in his journal, and he looked me up, and I went to his wedding, and he walked down the aisle, and so just want you to know he's got prosthetic legs, and he may be on the list to have the first arm transplant. So that individual is still moving and shaking and doing quite well. You know, I'd love for nursing to be a beautiful, healthy profession. It isn't always that, but it can be. But I think if we start feeling that about ourselves and about our colleagues and treating each other in that beautiful, healthy way, then we can transform not only ourselves, but our units, our hospitals, our patients, our culture. You know, it's contagious. Every single day I go to work, I have the opportunity to change a life. I don't think everybody can say that. And for that, I'm grateful.
Thanks for joining us today. And remember, we want to hear from you. Click the banner below this video player to share your ideas and suggestions for Nursing Success TV. We'll see you next time.